where we talk about various issues pertaining to the shoulder joint, the knee, arthroscopy, and sports injuries. Well, a very interesting topic is cartilage injury of the knee. Have you had this sensation that your knee is not feeling normal, that something is rubbing inside or moving inside? Well, you need to look at this video to understand why. Hello friends, I am Dr. Aditya Sai. Welcome to our channel of the Shoulder and Knee Clinic. Cartilage injury is very common problem, and typically you can sustain it even while playing regular sports. So let's say you're running or you're playing football, you twist your ankle or your knee, there may be swelling inside the ankle or the knee. If it is not diagnosed, if it is missed, the pain will come down, but over a period of time, if the cartilage injury is not addressed, it can lead to cartilage wear and arthritis, and that is why it is very important to see this. How do we diagnose it? Well, you may have symptoms of swelling in your joint, you may have symptoms of intermittent locking in your joint or grinding sensation in your joint. Typically, in individuals below the age of 40 years, this represents a significant issue because if it is not treated, as their age progresses, the areas of cartilage wear can expand and lead to arthritis of the knee joint. So if it is diagnosed early and treated early, then it can prevent the development of arthritis. So how does it happen? Basically, in these twisting injuries or contact sports, there may be violent contact between the surfaces of bone which is covered by cartilage in your joint, and that pieces of cartilage can shear off. So they can float around in the joint, blocking the joint or locking it intermittently, forming loose bodies, or they can get stuck somewhere, and the piece of cartilage which is moved from its original place will leave a defect, and that defect can cause pain in your joint. It can also incite a synovial inflammation and cause swelling in your joint. So these are the symptoms with which these issues present. Now, when do you want to see somebody? Essentially, where you are having persistent swelling in your joint, you are having pain, difficulty in moving around or motion of the joint, and which is sustained over a period of time, then it's a good idea to see a professional help. Typically, an MRI will help in diagnosing these problems. Now, treatment of these injuries essentially depend on the significance. So there are systems of grading cartilage defects, the size of the defect. So typically a grade 4 defect of the cartilage, where it is involving more than 1 square centimeter area of the joint, needs some form of a surgical treatment. In smaller defects, essentially we work on activity modification, injections into the joint to allow the cartilage to normalize. It doesn't heal, but your symptoms come down. If there are loose bodies, again that needs to be addressed. So essentially there are multiple procedures to address cartilage injuries, starting from the very basic, like a microfracture, where we create small holes in the bone, allowing the bone marrow to escape. That forms an area similar to cartilage. That's called a fibrocartilage. This is the most basic of procedures. Then there are options where your bone marrow can be injected in the area of defect of the cartilage, allowing for a healing response. Then there are procedures where cartilage from non-weight bearing areas of your joint can be transferred to the cartilage defect areas so as to allow for painless movement. And then there are two-stage procedures where artificial cartilage cells are grown and implanted. So there are multiple treatment options for this, but the basic criteria is that it should be a post-traumatic injury, it should be a small area of cartilage defect, and there should not be any presence of gross arthritis, because once there is presence of gross arthritis, then none of these cartilage repair works. So if you are having persistent issue in your joints, if you are having sensation of grinding or clicking in your joint repeatedly, if you are having swelling in your joint, your age is less than 40 with all these symptoms, do seek professional consult. Early treatment and early intervention can prevent a lot of issues in the future. If you liked our channel, then do share, like and subscribe. Thank you for watching.